This is a presentation about hiring GP locums and how to get the best out of them. It's a guide for practice managers, and I've created it based on the experience that I've gained over around 8 years chairing the North East Sessional GP group. There are lots of things that go through your mind when you need to hire a locum, such as where do I find them, how do I know they're okay, will there be any surprises, what does the fee include or exclude, how do I prepare for them, how much is a reasonable fee, do I use a freelance locum or somebody through an intermediary such as an agency, chambers or web platform, how do I ensure they're supported and things run smoothly, who decides what they're prepared to do, and what about longer term locums, are they different, how do I make sure they come back? How do I raise problems and complaints? And how do we agree terms? So I'm hoping to cover all these things in this presentation. So there are currently a couple of ways to hire locums, either directly, hiring a freelance locum, or through intermediaries. If you're hiring somebody freelance, you're often going off a recommendation from a colleague or accessing them through a website such as the North East Sessional GP group. If you're going through intermediaries, the options are an agency, a web platform, a chambers, or a federation bank. If you're hiring them freelance, you obviously have to do all your own checks for the documentation, such as their qualifications, DBS check and indemnity, and the negotiation about terms and fees happens directly between yourself and the locum. However, if you hire them through an intermediary, the checks have been done for you, which saves you a lot of time, and the terms are usually mainly set already, but this is obviously reflected in the fee. Do remember, however, that when you're dealing with freelance locums, many of them have their certificates readily available for you on a cloud-based system, a link, for example, via Dropbox, Google Drive or Locum Deck. There are a number of pre-employment checks you'll expect to do when you hire a locum. These are set out on the CQC's website, and they include personal things like checking the ID, whether they're a GP, and whether they're competent enough to do the job and reputable. So once you've checked their ID, you'll need to check things like their CCT or MRCGP, their GMC registration and medical performers list, and also in terms of their competence and reputation, their references, CV, their DBS, medical defence, whether they know the clinical computer system that you have, and you may want to check their mandatory training certificates. So when choosing to work through an intermediary, there are a couple of options. One is to use an intermediary where you have some involvement with an office-based manager versus an intermediary that is purely web-based. So if you're accessing a chambers or an agency, usually there is the involvement of an office manager in that process, and that allows you to develop a personal relationship with the person that will be helping you, and also gives you a port of call for raising any concerns or queries. A web-based platform is much more impersonal and automated, so there's the locums put their diary of availability online, as they do also their documentations with certificates, and there's usually an online published set of terms and conditions which are standardized, and so all of this is made available to you without having to interact or wait for a response from an individual. It's important to realise that all of these platforms charge a fee to somebody. So agencies charge a percentage of the locum fee to the practice, chambers charge a percentage of the fee to the locum, and web platforms can operate in either of those two models as well. So they may either make their fee from the practice or from the locum. And in terms of the platforms that assist locums, they may be based on a fixed price per month or a percentage of the fee. So there isn't one right model, and it depends really on the kind of service that you're after, and each of those two models have their benefits and downsides. So what can you expect a locum to do? Well, this depends very much on the individual, and even different locums may have different terms for different practices, but it's probably useful to look at it in this way. There is the core work that might be included in their fee, so that's usually a number of appointments. It may include visits, and then any referrals, tests or prescriptions arising from that caseload. In the amber zone is the zone which is a little bit more uncertain, and this needs to be very much clarified with each locum. So Will they be doing repeat prescriptions? Are they prepared to do on call? Do they do any telephone triage? Will they be prepared to see extras or do extra visits? And this is something that must be clarified in advance, because it's much more variable between locums and often will be subject to an extra fee. In the red zone are the things that most locums working short term will usually not do, and so that includes private reports, looking at letters or results that are meant for other doctors, and supervision of registrars, practice nurses and nurse practitioners. So when looking at this range of work, it's important to clarify, is it part of the core work? Is there an extra fee? Is it something that they're prepared to be asked to do on the day for an extra fee? Or is it work that really will only be considered part of the fee for a longer term locum? And also worth discussing and just clarifying what the cancellation fees are, and these usually are in a stepped fashion, so depending on the period of notice there may be a fee which is a proportion of the overall fee. So when you're hiring a locum, many of them may have very clearly written terms of engagement that you can check through, but if not, it's worth having a checklist of things to run through. So what are their fees and what do they include? Is there a fee for overrunning? Do they only do their own labs and letters, which is standard and advised by the Medical Defence Union? Will they do repeat prescriptions? And currently 2/3 of locums will not sign these, which is also supported by the Medical Defence organisations. What are their cancellation terms? Are there any add-ons or extra fees, for example for on-call, extras, visits, reports and so on? And for longer term locums, worth just checking how much holiday they intend to take and having an agreed notice period for taking that leave. Also whether they intend to participate in your on-call rota and what frequency they're prepared to offer, and also considering offering an induction in paid time within their first session. So there's two ways in which the locum fee can be defined. Some people prefer to go by time, so they charge a fee for an hourly rate, and the downsides to this are that you don't know what the speed is at which the locum works, so what they'll be able to achieve for each hour, and therefore you're agreeing to a variable fee. It may appear more flexible because you can ask them to do whatever needs to be done on the day potentially, but you have the uncertainty of the fee. There's also increased risk for the locum because they may be expected to work outside of their comfort zone. In terms of the other alternative, which is to price fees for a certain workload, there's greater clarity for that on both sides. It can appear less flexible to the practice because if you then, for example, have no visits and you've been priced for visits, potentially you're paying a fee for work that you haven't needed. It is used more commonly, and it allows locums to ensure that they keep to a level of comfort and competency that's within their experience. It's worth just being aware about the difference between having a GP work for you on a self-employed basis as a locum and having somebody work for you on an employed basis as a salaried GP. So if they're self-employed, they will expect to have control over their work, what work they do, when and how they do it, and not be under direct supervision. Whereas an employed salaried GP, of course, would expect their workload to be determined by their place of work and also how it's done and when it should be finished. So you can't expect to have the same degree of control over a locum GP that you would have over a salaried GP. Let's look at how to make things run smoothly when you hire a locum. It's all about being prepared and organised. So there are things to consider at booking, on arrival and on leaving. So at booking, you're wanting to clarify the terms of engagement and the fee, and also get things organised for the login. You need to get their smart card number and ask them whether they want to be logged in onto ICE, the test requesting system, and also to what extent they're familiar with using Choose and Book, or whether this is something they would normally need assistance from your administrative staff with. You also want to make sure there's an locum induction file ready, and you can send that across to them in advance, and also ask them their car registration number if any parking arrangements are necessary to make in advance. You'll also be obtaining all the essential documentation we've spoken about, and you may want to discuss what your dictation system is. On arrival, it's important to have all the logins ready to pass on to the locum for both the computer system and the clinical system, as well as the requesting system for tests. Make sure that all the internal and external telephone numbers are ready, and there's an induction folder. Explain what the system is for arranging referrals, how to contact secretaries, and how to use the dictation system. Tell them who is on call for the day and how they obtain a chaperone, where emergency drugs are kept, as well as the defibrillator, and who to give their superannuation forms and invoice to. And then on leaving, making sure you facilitate any necessary handovers between the locum and any of your own clinicians, making sure that all referrals have been actioned, and also handing over signed superannuation forms and taking on invoices. You also may need to handle any feedback or complaints either way. One of the things you need to understand is how locums superannuate their work. So 90% of the locum fee is superannuable for most locum work, and that's when the Form A and Form B is in use. So the locum will contribute a percentage of that fee in terms of employee superannuation, and then they will invoice you 14.38% of the headline fee for the employer's superannuation. So the invoiced fee is a combination of an original fee and the employer's superannuation. The locum then needs to pass on the employees and the employer's part of the fee to NHS England, usually by backs, by a certain deadline, which is usually the 7th of the month following which they're paid. It's therefore very important that practices sign superannuation forms promptly and pay promptly. We recently did a survey of locums to ask them what factors were most important in their choice of practice, and this is what we found out in terms of order of priority. Most important of all was that the practice respected their agreed terms and conditions. The next most important factor was support from clinicians within the practice. In next place, there were factors around visiting rates, feeling included in the team, and the fee. And next, the factors were prompt payment, there not being last-minute cancellations, the room being well stocked and well prepared, and the computer system being one they're familiar with. And finally, knowing that support provide adequate reception provide adequate support, induction, and the distance from home. In our survey, we also asked them in free text to explain any additional factors that we might not have anticipated. And the ones that they volunteered were familiarity with the practice was a big factor, whether the patients were perceived to be very demanding, whether there was an expectation of on-call, and whether there was a referral management system whereby their referrals had to be vetted, which made things more complex and more fiddly to complete. And finally, if there was a lack of a dictation system. So the important things to take away from this are that there are several factors here that are within your control to improve the way you attract and retain locums. Respecting agreed terms and conditions is a key one, so making sure that if you hire a locum on the basis of doing a set amount of work, that you stick to that agreement. If you need a different package, then you need to be making sure up front that that locum is happy to do that, or that you get a different locum. Making sure you provide support for dictation and support in general from your clinicians to discuss any queries and understanding the services and systems. Prompt payment, avoiding last-minute cancellation, and having an adequately stocked room are also factors that you can influence, as are making the locum feel included in your team and providing adequate support from reception and adequate induction, and not expecting them to be on call if they have indicated this is not part of their fee. GMC has useful guidance on the issue of prescribing and repeat prescribing. So it says that when you issue repeat prescriptions, you must be satisfied that the procedures for generating the prescriptions are secure. Also, that the patient's condition is monitored, and that only staff who are competent to do so prepare repeat prescriptions for authorisation. Any changes to the patient's medicines are critically reviewed and quickly incorporated into their record. So there are quite a lot of things that you need to be satisfied with as a locum before you can safely sign repeat prescriptions in the same way as a doctor who is a substantive member of that team. The following quotes from locums in our survey reflects these considerations. I don't like to be asked by nurse or receptionist to just sign this. I state in my confirmation email that I don't do nurse or repeat prescribing. Not safe. I don't know most of their patients or the thoroughness of their med reviews. I will agree to sign on occasions, provided medication reviews are in date, items on script are in line with prescribing guidance and are straightforward. I won't sign, for example, NSAIDs or night sedation on repeat. So if we look at the possible scenarios where a locum might be asked to sign prescriptions, obviously prescribing within the consultation is the gold standard in keeping with GMC guidance. So they have full access to patient record, there's time to assess and counsel the patient. The next scenario is where the locum is confident that the medication review systems exist, they're known to him or her, and they're safe, including protocols for the nurse practitioner and practice nurse. And this is really only likely to arise if they're doing a longer term locum or are familiar with the practice. The other possibility here, where they may be prepared to sign repeat prescriptions, is if they're allocated time to review each record for each prescription. And this scenario tends to only arise where there have been no visits and there's been prior agreement with a locum. A situation where the locum is unfamiliar with the practice or they feel the medication review systems are unsafe, they're being asked to sign prescriptions for high-risk drugs such as NSAIDs, controlled drugs, Z drugs, or on behalf of other clinicians whose protocols and competence they're unfamiliar with, they're unlikely to agree. Also, they're unlikely to agree to sign scripts outside of the review period, as they would have to review each individual patient record to make a safe decision and may not have been allocated time for this. So I hope you found those practical examples useful. Do get in touch with me to give me your feedback at my NHSnet address and consider subscribing to my YouTube channel. Thank you.